lot of discussion about whether the actual incidence of port site hernia is higher than the perceived incidence. In my opinion, I suppose it doesn't really make a difference, in the sense that whether the rate is 39% or 20% or 10% or 5%, 5% of patients who are having a complication from surgery that for the most part is unnecessary is something that really should be improved. Wound closure is actually a very complex physiologic process, but if you could distill it down to its simplest principle, it has to do with neovascularization and vascular supply to healing tissues. One of the challenging components of reapproximating fascia during port closures is the difficulty of not strangulating the tissue. One of the promising components offered by neoClose is that it works on what we would call an X vector. So rather than tissue that comes in a loop is tied down and has the potential to strangulate the tissue in between, the X vector is taking pledgets that are bringing the tissue together in a closure that is presumed to be less strangulating, thereby allowing a better blood supply to the fascia and improved wound closure. I believe that the central principle to wound healing is vascularity of the tissues. The concern that I've had with some older port closure methods is that the loop closure may be strangulating the tissue and thereby causing necrosis. The advantage of neoClose is that it offers the ability to reapproximate tissues, bring the tissues closer together without that tight strangulation that's likely to reduce the vascularity and neovascularity needed to have a strong wound reapproximation. Recently, there's been a lot of discussion that some of the newer techniques, minimally invasive techniques such as robotic surgery, may be contributing to a higher incidence of port site hernia. I'm not quite sure that I think it's the newer techniques, but rather who we're operating on now. So what we're seeing are patients with higher BMIs. So their fascia is deeper. And actually getting a good grasp of that tissue, I think, is more and more difficult. So what we're finding is, I believe, the increased risk of port site hernia is related to tissues that are not appropriately reapproximated. For minimally invasive surgeons focused on laparoscopic and robotic procedures, port site closure, to me, is essential. Finding the right tools to bring the fascia together without tight strangulation, to me, is the core of how to do it. On thinner patients, if that can be done with a single interrupted standard suture, great. The problem is that that's often not possible with the location and the distance of the fascia from the skin. So we've come up with a variety of devices to help us with that. The advantage of neoClose is, number one, that it's easy, number two, that it's standardized, and number three, that it seems to reapproximate the tissue without strangulating the tissue and causing further necrosis. That's the why, at the core, I think this technology is exciting and may help us reduce the problem of port site herniation.